I'm Glenn McGuinness, and this is Outburst. On the program, can the federal government afford dental and prescription drug coverage?
Not at the moment. I mean, we have such a huge deficit. We have debt, we have inflation.
It's about time, and the answer is yes, they can afford it.
Yeah, I know it's expensive, but I think it's something that should be done.
The money's there.
But first, it's been just over 2 years since this pandemic was declared, and in that time, we've had to become accustomed to new rules and regulations designed to keep us and everyone around us safe. To make things easier, the federal government did pitch in, offering financial help to businesses and individuals who needed it. But did they get things right? Our question.
Are you satisfied with the federal government's pandemic response?
I think we saw more from the provinces, and there was a exceptionally strong response at the beginning, both on the provincial and on the federal side. I think everyone is exhausted, including the politicians, and that we need to understand that. But we also need to keep everyone working forward.
I'm okay with it. I thought, there's been a lot of changing as things went on, and I think that they responded as best they could with the information they had.
I would agree with that. I think they did a pretty good job, given that they didn't really know what was coming. They were always kind of, it was always in a response to what was happening next. I do think there could have been a little bit more consistency in their response in terms of when they implement something, making sure it was consistent and held for a longer period of time, rather than trying to, cater to the loud voices that just, wanted to go back to normal but too soon.
Yes and no. I've been back and forth from England, from Manitoba, throughout Canada, and I've seen the different, from provinces to province, how the differences are. And in Ontario, it's been a little, when I've been traveling, I've seen the big differences, and so I feel like things have been closed up a little longer than it should have been. But the mask mandate's pretty good, but I just feel like things have been just shut down. It's done a lot of damage on, especially Ottawa. You've seen a lot of stores open and close, because of the pandemic. It's just been hard on the economy, especially in Ontario.
Personally, I am not. I think that recently, especially in the last few months, it's just been very divisive, and I just don't like to see how a country that used to be so united, especially in contrast to the United States, seems to have become so polarized and so angry. I mean, we saw it here at the convoy. I think Canadians just need a bit more compassion and a little bit more freedom to make, some choices for themselves and have those choices respected.
It's such an unknown. It's something we've never been through before. So the fact that, government leaders had to basically create rules from scratch, you do what you can do with the information given to you, but again, following the science and not what suits the political agenda. So I'd say it's a little bit of both, but in Ottawa, we felt safe for the most part.
It's something that's so difficult to actually account for realistically that, they've done probably as good a job as anybody could have. That, sure, it's not perfect, but kind of impossible to be perfect on.
Sure. Yeah, I would have liked, more consistency, but maybe my problems stem from more of the provincial aspects of the, trying to handle the pandemic. I don't know much about on the federal scale, but I feel like on provincial, things could have been handled a bit better.
Yeah, in general, I think they've done a pretty good job. They've been very supportive of workers and small businesses especially, and I think they've made a big difference. Could have been a lot worse for some of these people.
In terms of the pandemic and how they've treated for people, yes, I am. The mask restrictions now, I do like it where it's at, where it's recommended but not mandatory. The vaccines and all that, I think they've done a good job with that.
Working in healthcare.
Yeah, I work in healthcare. Sorry, and it was stressful. But I think the government did the best they could with what information that they had at the time.
They are taking away people's rights, right? It should be the freedom of choice to be able to wear your mask. If you want to take the vaccine, should be a freedom of choice and things like that, right?
Overall, I'd say yes. I think, I think the Trudeau government did the best that they could with what they were given. You know what I mean? It's unprecedented. Nobody had the answers. For all intents and purposes, I think that went as well as it could.
I am not saying that government is not doing anything. Government is doing far good for the public, but the public should understand that isolation is the only way to keep corona away from us. So yeah, government is doing well. Yeah, I would say, yeah.
Overall, I think everyone's doing the best they can. It's hard. I mean, there's no playbook for this. It's the first time for everyone, and I think overall everyone's just trying their best and making through it as best we can.
I think so. I thought that the vaccine rollout was okay, and I didn't really have any qualms with it, but I think that, you know, they kind of followed the information and science that they had at that time. So, I mean, that's all I can ask for.
As someone with a compromised immune system, I'm not entirely satisfied. You know, and it's unfortunate that the whole pandemic has become so politicized. You know, it's not a political issue. It's a public safety issue. And I think that's how it should have been approached and should have been dealt with, and it hasn't been dealt that way so far.
Yes, I would say by and large. I know people are going to pillory whoever it was. If it was the Conservatives in power, they, you know, the NDP and the Liberals would have beat them up for doing too much or not enough or whatever. You know, if anyone had a crystal ball on the COVID response, they'd be geniuses. And every province with all different various governments has tried things. They haven't worked. They have worked. It's a pandemic for a reason. This isn't some sort of easy solution. No, everyone was caught off guard. Is there certain things that the feds could have done better? No, I actually was all right with the federal response.
In the recent deal struck by the NDP and the Liberals, one of the stipulations in that agreement by the NDP is dental and prescription drug coverage, which was mentioned in the federal budget. Canada is the only nation with a universal health care program that does not include prescription drug coverage. The idea is nothing new, and it's been floated around for decades. But can we handle the costs involved? We took to the streets to ask Canadians if they feel we have the dough to foot the bill. Our question.
Can the federal government afford dental and prescription drug coverage?
Yeah, I know it's expensive, but I think it's something that should be done. I mean, there's so many people that, you know, can't afford to look after their dental health, and that's pretty important because if your teeth really get in bad shape, you're going to end up in the hospital. So expensive, but I think it's, you know, I think it's doable.
I don't know if they can right now with everything that's happened, but it is a good thing that it should be made free for people who can't afford it, yeah. I think so.
I think, yes. I mean, they've ballooned up the deficit in all sorts of other ways. And so I think individual Canadians, because I know of some lower income Canadians who have terrible dental problems, and I think it's about time. It's how is it your mouth is not part of your body, you know? So I think, yeah, it's long overdue.
Can they not? I mean, you're going to save on healthcare costs with improved dental care, right? And so... Yeah. You know, you save a little bit here, you get to pay it on the other side, and it's about time, and the answer is yes, they can afford it. Yes. And we all can, yeah. We can all pitch in.
I totally agree. You know, take care of the problem at the front, because at the end, it will cost more.
Yeah.
So I totally agree, yes.
It's got to be paid for, and if you want it, you've got to pay for it. So taxes are going to be affected. I'm amazed at all the money the government's been handing out over the last couple of years and how that's going to be dealt with. But healthcare is just one of the beautiful things about living in Canada, so we're all for it.
The money's there. I mean, the government says, oh, we don't have money for this, we don't have money for this. There's a lot of money going around. If they got money to shoot off a few guns and to support the warfare, then they got money to help the Canadian people for dental care and health care. You name it.
Yes, I think our government can afford to have dental coverage and drug coverage for every single citizen of Canada. It's a priority that I'm passionate about.
Do you think when Tommy Douglas suggested Medicare that Canada thought that we could afford it, but we did it? And I think maybe that's just how it has to be. And yeah, I think that we can make it happen. We have to, I think, because people are important, and without medical and dental, we're not showing that.
You know, we can afford everything else. We were afforded COVID.
the $2,000 CERB every month. I got a couple of those, so if we can afford that, we can afford anything.
Yeah, I think they just might have to take money from stuff that isn't as important, because I feel like healthcare and dental should be a priority. Every Canadian likes to brag about how we have free healthcare, but someone gets a $60,000 dental plan and they're out of luck, and that should be included in our health, because if you don't have working teeth, you're not really doing too well, are you?
I think it's a really good idea in the fact that, everybody should have, access to it. Is it affordable? I don't know. I don't understand Canada economics. Economics on that standard. I don't get to print money, so I don't understand it. So I hope it works out. I really do.
Not at the moment. I mean, we have such a huge deficit. We have debt. We have inflation. The idea of free pharmacare is not that I don't oppose it, in the sense that I rely on medication, and the idea that somebody could not afford that. But the provinces have programs in place, like in Ontario, we have OHIP Plus. I think that the provinces should be the ones dealing with things like dental and pharmacare, and I think right now, amid an economic recovery, that is not a wise investment to make.
I mean, if we can cover all the medical expenses aside from that, why not include that in there? I mean, our taxes are already decently high, but I mean, there's plenty of money to go around, I'm sure.
The issue is, can the economy afford it? I would say it can. I think it's looking seriously at where the economy is growing, looking at where people are. We're coming out of COVID. Growth's been good for 8 months. It seems to me it's a reasonable standard, and the people will benefit, like workers will benefit. It's better supported. People will be at work.
I certainly think that they should make sure that they can afford it. I think it's incredibly important, and it is something that I believe that they can figure out, and they will figure it out, because it's something that we as Canadians need. Like with the income disparity, too many Canadians need this, that they're going to have to figure it out.
I think they can, and it's about time. I think they, if they really want to make this happen, they will find the ways of, redistributing certain costs that really have been, held on for too long in other areas.
To be very honest with you, I don't know what they can afford. I mean, they've been spending so much money, but I think it's important anyways. Look at me, I'm a senior. I think somebody in my condition has a disability, anything they can do to help, I think would be good, yes.
How many Canadian Prime Ministers were born in Alberta? 1, 2, or 3?
2.
I say 3. 1.
Is that a trick question? Let me see. I have no idea. 1.
3.
3.
1.
1.
3.
The answer is 1. You're the man.
I know.
He's from Alberta.
Oh, there you go.
While Ontario and Quebec is where most of Canada's prime ministers were born, the number of prime ministers born in Alberta is 1. Joe Clark was born in High River, Alberta on June 5, 1939, and is Canada's only Albertan-born prime minister. He also became Canada's youngest prime minister when he took office on June 4, 1979, one day before his 40th birthday.
For young people, buying a home in today's market is virtually impossible, and high rental prices don't help the matter either. The price of everyday essentials continue to rise while wages stay the same. And many say a wage gap and a gender wage gap still exists in this country. One suggested idea to help with this is a guaranteed basic income for low-income families and individuals. But we took to the streets to ask Canadians what other ideas they may have to fix this problem. Our question:
what are your ideas to narrow the wage gap in Canada?
I think that Canada needs to help with the housing, like the affordability of housing for young families, young people, have a higher wage of living that's based on I mean, a higher wage based on what's the living cost right now, because they're not equal at all, and I think that would also help the opioid crisis too, because it's just there's too much hopelessness and people need to hope.
Well, I don't know. I'm someone, I've been a person with disabilities my whole life. I'm a little bit scared of money because of that. But you know, I think this living wage is a smart idea. Again, anything to make it so that people can live healthy and they can feed themselves, they can have their medical, they can have their dental, they can take care of themselves. It's important.
Some people work harder than others too, right? Like some people don't want to work as hard. Some people maybe can't work as hard. And is that fair for them to not make as much money? I don't know. I work hard. I make good dollars, but I work hard. You know, so I trade a lot of personal time and family time for work. So it would sure be nice though if everyone could have a living wage and we could afford to do that.
Well, I don't see why we can't have a higher minimum wage. I know it got raised to like $15 an hour, but that's $30K a year, and in Victoria, rent is like $1,800 a month. So in Australia, they have about $25 an hour minimum wage, same with Scandinavian countries, so I feel like that would be a good place to start.
I think if you make more, you should be paying more, but then not burden the middle class too much, because if you look at the tax brackets, the middle class end up paying the most, and the guys that are making, I guess obscene amounts hardly pay any tax. That's not right. You can't make the people in the middle suffer for everyone, and then the guys at the top who make most of the money then pay very little. We have to fix that. That's not right.
There's a lot of offshore tax evasion going on in Canada, and they are not on it. The wealthy don't pay taxes, and because they don't follow the rules. It's not that it's not that they're not paying enough taxes. They just aren't following the rules. So there's a little bit of, CRA has to tap down a bit. I think would help with the cash flow.
I think that one of the problems is a lot of people who are on these low-wage jobs don't have opportunities for education to get into a higher age job. So I would like to see more training in terms of that. And, also, minimum wage is pretty minimum. If we have to look at the other balance, if you're going to allow people to make that low a wage, then you're going to have to do more with affordable housing and things so that those people can afford to actually live a normal life on that wage. So, one or the other, it's either increase wages, increase education so they can get, but those jobs are still there. If you increase the education, we still need those jobs service. So we need places for them to live, and they have to be able to afford a decent living.
So I have some ideas. It probably wouldn't be popular. I mean, I think there are countries where the most senior leaders and organizations have a certain percentage more than they can earn for people lower. So there are those kinds of ideas. I think, obviously, taxation, get tax more up above and redistribute down below. And actually, I heard an interesting story about using, setting in place like universal, like basic income, and how that actually benefits the society as a whole.
Tax the rich people far more. That's the main thing that we should be doing, I think.
Yeah, why do you think that would work?
Well, let's see. I mean, there's many things we can go into. There's going into just a universal wage as well, which has been proposed before at other places. But anyway, I think it would work mainly because if we could actually distribute the wealth more evenly, it would just take a lot of people out of poverty to begin with. Yeah.
Anything got?
I mean, yeah, I've heard about UBI, but I don't know. There are always unforeseen consequences with any kind of method to alleviate one problem, right? You end up with others. So it's hard for me to give an opinion that I wouldn't feel would come along with a whole host of other problems.
Probably raising minimum wage, yeah, because I know like most people living in minimum wage have difficulties even like just paying their rent and their food and all of that. So definitely, and I'm a student, so I can attest it's difficult to like live just on a minimum wage salary.
Well, I think the Ontario government's been trying to increase the minimum wage, and that helps. I don't think it's a situation where it's ever going to be resolved. To be very honest with you, I don't know what they can do. To be honest with you, I mean, keep the unemployment rate down. Yeah, that helps. But this thing about taking from the rich to give to the poor, I don't know. I really don't.
I do like the idea of adjusting the tax brackets so that we can have a better distribution of the wealth of the services that are available to make sure that people who are in need of support get that support.
Here in Canada, many jurisdictions have been easing restrictions when it comes to masks and public gathering limits for a while now. And even though many Canadians are free to go about living their lives, vaccine mandates still do exist for Canadians traveling within and departing Canada. This has, of course, created great divisions in this country for those who feel it should be their choice to be vaccinated or not, especially in the trucking industry. So we took to the streets to ask Canadians if they feel we should continue these vaccine mandates or move on from them. Our question:
should the federal government keep or remove vaccine mandates?
I think they should be continued until we're really past the hump of the pandemic. And this is from people who had to go get like our negative tests and do all this documentation to come in and go home. And I mean, I think people are already kind of used to it. They're not happy with it. But I think until we know like things are much safer, I think they should be continued.
I feel like we all have free will. So I think it should remove the vaccine mandates. But I really like the masks. I feel like that's really helped me. Yeah, the mask they should keep, but the mandate, I don't think that should be a law.
Oh, well, you're talking to triple vaccinated,
flu vaccinated.
Yeah, face mask wearing young ladies that make our kids do it. Like, so, I respect people's right to be different, but
everybody has a different opinion.
I'm like, mandate the hell out of it. You can't go to a foreign country. You couldn't work in Saudi Arabia without being vaccinated to the hilt. You can't go, every other place, there are rules, and we wear seatbelts, and I just think it's a bit weird.
You wear seatbelts, when our children, before starting school, before starting kindergarten, they have to have all their vaccines, or else they can't go.
This vaccine triggered everything. I don't know what it was, because it came in quickly or something?
Maybe.
I think it's time to take them off. This travel one, especially at getting vaccinations to go to and fro across the border when, I think the U.S. is as open as we are about masks and things, and I can't see the problem now. I think there was a time for it, but I think the time has passed.
Personally, I've not had a problem. I've worked in China for 4 postings. I studied the original documents from 1400 years ago when vaccine mandates and variolated vaccines were invented by the Chinese. It's just science. We're living in a funny world. Look, the issue is, as of today, 37,740 people have died from COVID. We lost more people in 6 years of war, less people, I should say, in 6 years of war. It's an interesting anti-science discussion that doesn't make a lot of sense, from my point of view.
The science is kind of showing us that it's a little bit less of a threat now. So, and if we do push more of the mandates, I'm seeing more and more people who are all for following the rules get tired and start to push back. So I feel like it might create more problems than actually have everybody jump back on board as they were with the same enthusiasm at the beginning of the pandemic.
What about you? Well, I feel like just as far as restrictions go in general, we should probably ease up on them entirely. I mean, anybody who will be getting vaccinated has already gotten vaccinated.
I certainly don't think it's time to turf them just yet. I think we're not out of this just yet. We've been heading in good directions, but every time we head in good directions, I think we act too quickly to say, oh, it's done. And we try and get rid of the things that are keeping us safe too quickly, and then we end up going back into the bad spots that we were in.
No, I absolutely think the vaccine mandates that are currently in existence should still stay, and I think we were too quick to get rid of provincial level measures as well. So definitely keep the federal ones for now, for sure.
I think we have to keep something in place just to be careful, because everything we hear with the new wave and that sort of thing, I think that I'm just, my own personal opinion is I don't think it's ever going to go away, and we have, as citizens, have to be more cognizant of that and do our role. That's all, I think.
I just want to say that I have had my 3 shots, and I'm a big supporter of vaccines. I got the vaccine as soon as I could, but I also know people who didn't want the vaccine or that are unvaccinated, and I think that the fact that these people are banned from flying inside Canada when, with the different variants, it has shown that the vaccine works more to reduce the severity of the illness rather than transmission. I don't think that's something that is very fair. I think if you're going to have a mandate in place, you have to have alternatives such as testing. And for me, it just makes me really uncomfortable to think that certain Canadians are banned from simple aspects of public life just because they made a different medical decision.
Initially, I was for the mandates, but the mandates, the vaccine, I'm vaccinated and I got COVID. I had a week, I was sick for a week. I spread it to my wife. So it was like, I didn't feel there's really much gained. Other than I also have doctor friends and such who said they figured that it maybe slowed down the number of people that were holding up the ICUs. So once again, I'm glad I wasn't having to make the decisions on it. I think there was good and bad to it. There was good sides, bad sides. I'm not really for it, though. Not really for the mandates.
Those that haven't got the vaccination are still, I think, according to news reports, taking up a greater percentage of the hospital beds, which is creating still a problem for a lot of people that want to get surgeries on knees and hips, and they've been waiting 2 years for something, and for some of them it's getting to be too late.
Not that shouldn't take precautions, but we're never ever going to get over it the rate we're going, doing what we're doing. So we need to do something different.
No, there is reasonable doubt, I think, that they're not 100% effective, and that's that. I mean, why force someone to get something that's not even really effective? Unless maybe you're at high risk and you feel like you need it because, you want to stay out of the hospital. So that's all I could say about that one. I am double vax, but I'm no booster, no way.
Thanks for watching this episode of Outburst on CPAC. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. I'm Glenn McGuinness, and on behalf of my colleagues at the Cable Public Affairs Channel, thanks for watching. We'll see you next time.